Hello, welcome to Dr. Noor J Therapy channel. In this video, we are going to talk about public health and community medicine. Community medicine is a branch of medicine which deals with the study of provision, prevention, promotive, curative, rehabilitative, and evaluative services to the community at large through an organized and comprehensive healthcare delivery system. The goal is to identify the health problems and the needs of a defined population to provide a comprehensive health care in an organized manner followed by evaluation of services. Health. Health is a state of complete physical, mental, social, spiritual well-being, not merely an absence of a disease or infirmity. According to WHO, disease, a condition in which body's health is impaired. Illness, it is a phenomena in which one or more natural functions of the body are distributed that the affected individual cannot meet the natural requirements of everyday life. If a person is going through illness, is said to be acutely ill, but if the illness is a long duration without disability, the affected person is said to be chronically ill. Well-being, it has two perspectives. Clinical is based on the absence of negative conditions. Psychological is based on the presence of positive attributes. There are the 6 characteristics of well-being. Number 1, active. The active pursuit of well-being, a balance of attributes, positive effect on a life satisfaction, pro-social behavior, multiple dimensions, and personal optimization. Now about objective components. Objective components includes all those variables which depend upon the monetary status of an individual, such as income level, standard of housing, nutrition, dress, and other comfort of a modern living. Subjective components include quality of life like health, happiness, education, physical quality of life like infant mortality rate, life expectancy, or literacy rate. Human Development Index. It based on GDP. GDP stands for gross domestic product. It is a gross income generated within the country, excluding the net income received from abroad. The others include Gender Related Development Index GDI, Gender Empowerment Measure GEM, Human Poverty Index GPI. Now we talk about determinants of health. The factors which determine the health of an individual could be inside the body, intrinsic factors, or could be the outside of the body like environmental factors. Some other promote like socio-economic circumstances, level of education, type of employment, lifestyle choices, type of housing, cultural norms and health belief, assess the quality of health service, assess the leisure amenities, exposure to adverse physical conditions, community network, genetic biological factor, assist to affordable, reliable transport, sense of control over life. Genetic factors like intrinsic factors include genotype. This is the natural coded inheritable information carried by living organism. Phenotypes. This is outward physical manifestation of organism, environmental, internal, by various organs and the system of the body, external, made up of physical, biological, or social environments. Iceberg disease. Iceberg is a phenomenon of diseases gives a picture of a spectrum of diseases in a community. The part of iceberg is below the water level is denoted as a subclinical undiagnosed, and the part which is visible is considered as clinically diagnosed diseases in the community. The figure represented that the cases and the diseases that are discovered and the cases and diseases that are undiscovered. Following are the some diseases that include iceberg phenomena like diabetes, hypertension, malnutrition, polio, and leprosy. Medicine. The role of a scientific discipline is that medicine, by providing health and preventing the illness, and its major work is to adjust the individual and their society according to their uses and useful society creation by restoring health, rehabilitating the former patients, and adjusting the individual to their environments. Preventive medicine. Preventive medicine refers to the measures taken to prevent the disease rather than curing them. It includes universal prevention, address the entire population like national, local community, schools or districts. Selective prevention, which focus on group whose risk of developing problems of alcohol abuse or dependence is above average. Indicated prevention involves a screening process and the aim to identify individuals who are at the early sign of substance of abuse and other problems, behaviors, and other problems like parenting peer groups or schools or outsiders. Environmental prevention, which ranges from the ultimate restrictions like prohibition of alcohol advertisement or ban the smoking in public places. Community medicine. The term preventive medicine and community medicines are used together most of the time, which focus on the health and define the population in order to promote and maintain health, well-being, prevent disease, disability, and premature death. Community health. This is defined as a provision of preventive services mainly outside the hospital involving the surveillance of special groups of the population such as preschool, school children, women and elderly by means of a routine clinical assessment and screening test. It also defined as a subset of the health and human service system. Public health. Public health is the science of art of preventing disease, prolong life and promoting physical health and efficacy through an organized community efforts for the satisfaction of environment and the control of communicable infections and the education of an individual in a personal hygiene and the organized standardization of a medical and nursing services for a elderly diagnosis and preventive treatment of disease, and the development of social machinery which will ensure every individual in a community a standard of living adequate for the maintenance of health and for organization, and these benefits in such a fashion as enable the every citizen to realize his birthright and longevity. This diagram is showing the relationship between preventive medicine and public health. Preventive medicine is the science and the art of preventing disease, prolonging life, and promoting physical and mental health and efficacy for the group of communities by public health, and for the individual and the families by private health practitioners. Now we talk about socio-economic determinants of health. Health inequalities and the health gap result from differences in the general society economics conditions that people operate in. Health inequality and gaps could be a very much effect on the society. This this uh, is a social this is the social determinants of health pathway. In first one, socio-economic political contexts like governance, policy and culture, social norms, social position like education, occupation, income, gender, ethnicity on race. Then material circumstances, social coherence, psychological factors, behaviors and biological factors distribute of health and well-being through healthcare system. This is an health determinant model. The rainbow of the diagram is determined the health is depend on these kind factors. A further pathway model has developed by WHO Global Commission and the social determinants of health, showing the different social determinants lead to the health inequality. We all need equally participation and equal opportunities for everyone to achieve their healthy lifestyles. Functions of public health system. The essential functions are population health assessment, which includes population community health need assessment, health status report, the system report cards of our system, health surveillance, period of health survey, cancers and other diseases, data of that emergency programs, diseases and injury prevention, immunization, investigation and outbreak control, encouraging healthy behavior and the early detection of cancers, health protection, assurance of safety food and water, and the regularity framework for the control of infectious diseases, protection from environmental threats. Health promotion include community partnership to solve the health problems, advocacy for health public policies, and physical and social environmental support of health. And last one includes health emergency response to the natural disasters of infection diseases, outbreak, accidents, criminal and terrorist acts involving the different threats. Now, the role of public health system. It includes the five similar identified roles like public health service provision for the local level or primary level, planning and advising on programs like primary on provisional or district level, funding at the federal and provisional district level, providing the technical assistance, technical, analytical, scientific, or advocacy, advisory, professional, and medical advices. Funding include at the federal and the provisional and the district level, providing a technical assistance like technical analysis, scientific and professional medical advices, support for local organization. Governance make the making decisions, adopting policies. Public health medicine. Public health medicines for are the community to aim and advance the health of population, which shows in the figure the basic public health. It shows that the assessment, policy development, and assurance are necessary to work together. Administrative medicine is a susceptibility of community aims to improve the health status of population through the practice of evidence-based medicine and health service management. Evidence-based public health. It is a process of decision making based on synthesis of the best available evidences applicable for theoretical models, professional experiences, and the knowledge of specific population. The 5 steps of EBP ask: first step to define your problem, acquire the second step to search for the information, appraise the next step for result of your research, apply. Once you have satisfactory amount of evidence, you will apply it to your situation. Assist. Finally, you need to assess the results of your invention, program, and policy. Social medicines. It is a study of medicine in total environment, physical, biological, and socio-economic. It is concerned not only with the curative medicine but also with the health promotion and prevention. Social hygiene. Social hygiene refers to the science of prevention and the treatment of transmitted infections. The concept of prevention. An action to reduce or to eliminate the onset of causes, complication, reoccurrences of disease. Prevention can simply define as the action to reduce or to eliminate the onset, causes and complication and reoccurrences of disease. But in general concept, prevention is characterized by the activities that are designed to reduce the likelihood that something is harmful with occur of the minimize that harm if it does occur. The level of prevention. The level of prevention includes primary prevention, secondary prevention, and tertiary prevention. Primary, which focus on health promotion and specific protection. Health promotion includes like health education and other awareness, selective examination, or specific immunization or environmental sanitization, and against occupational hazards. Whereas secondary prevention include earlier diagnosis and promote treatment, like cases finding the measures of individual or mass, screening survey, selective examination to cure and prevent the disease process, disability limitation, equated treatment to arrest the disease process and prevent the further complications. And the third tertiary one includes rehabilitation, provision of hospital and community facilities for the best possible capabilities, education of public and industrial utilize the rehabilitated utilized and rehabilitated a full employment possibilities. Prevention and public health. It include the better health in population rather than focusing on a health or any individual. Benefits of prevention. As we talked about primary, secondary, and tertiary prevention, primary can prevent so many risks, cardiovascular health maintained, and also the risk of other injuries. In communicable disease, immunization can save the environment. In secondary is at risk, screening can help out. Screening take a test and early diagnosis can stop that disease, and first aid is best for this promote of treatment. Tertiary care in isolation or quarantine, then ULB rehabilitation in cancers and CVS, cardiac rehabilitation, stress reduction, or optional rehabilitation for some other injuries. Thank you so much. Please don't forget to like and subscribe. This is Dr. Nurjay Therapy.